Local, late breaking. This is WBAL TV 11 News, Sunday morning.
Coming up in this morning's medical alert, a look at Orioles pitcher Kyle Bradish's injury. We talk with the sports medicine doctor about the injury and the treatment options available. Well, Orioles opening day is just over a week away, but one of the O's top stars will likely start the year on the injured list. Pitcher Kyle Bradish reported to camp with the strained UCL, an injury that could be a risk for Tommy John surgery. Joining us live this morning with more on the injury and the treatment is Dr. Mark Slabaugh with Mercy Medical Center. Good morning.
Good morning. How are you?
Good. So thanks so much for joining us here. For people who don't know what the UCL is, tell us about that. What does it mean?
The UCL is the ulnar collateral ligament. It's one of the ligaments on the inside or the medial aspect of your knee, and it's very commonly injured in pitchers. Unfortunately, because of the pitching mechanism and what they do, they put a lot of stress on that elbow ligament.
So this isn't necessarily an uncommon injury.
No, unfortunately, it's very common, especially in individuals that have been pitching for such a long time. There's so much pressure on these kids to start earlier and earlier to develop their mechanics. And so because of that, it puts a lot of stress over the time that they're pitching up into the professional baseball careers. There's a lot of individuals that injure that ligament.
And there are treatments for it. So we've heard about the PRP injections. What is that? And is it going to be helpful in this situation? Do we know?
So what the PRP injection is, it's a platelet-rich plasma injection, so where we take the blood and then we spin it down, and that creates a little bit of what we call an aliquot of platelet-rich plasma. That platelets, those have all the growth factors. So we've commonly done cortisone injections for different injuries in the past.
And that's for pain, usually.
Correct. But this is different. So what we're actually trying to get is some inflammation into that area so that it actually will heal that ligament and allow people to get back to the field much more quickly.
Okay, so if this works, how soon could Bradish return? That's what everybody wants to know.
Yes, that's obviously a very, very good question. I have not seen his MRI, so it depends on how much that ligament is torn. For the partial tears, this PRP injection helps a lot more quickly and a lot more significantly. If it's a full tear, then individuals typically require surgery in order to get back to the level that you have to be able to pitch at in the professional leagues.
So obviously the hope is that these injections work and he'll be able to return for this season. But
yes,
as you said, if it doesn't work, we could be looking at the entire season potentially without him.
Yes, unfortunately.
And so if it's not successful, then that could mean the Tommy John surgery. Explain to us what that is.
So the Tommy John surgery is that you take typically a ligament or a tendon from your wrist, and you use that in order to reconstruct that Tommy John ligament or that ulnar collateral ligament. And unfortunately, that surgery usually takes about 12 to 18 months to recover from. But we are using a new specialized ligament that augments that, called an internal brace, and that sometimes can help patients or athletes get back to the field more quickly.
All right, we're all hoping and praying that he has a quick return, but also a healthy return. That's what we want first and foremost. Thank you so much for coming in and explaining that to us.
You're very welcome. Have a great day.
You too.